This next section of the training video is maintenance. It's really important that you realize that we don't actually see a patient to just go over maintenance. What should happen if you're doing the program properly is every week when you see the patient for their sessions or biweekly or monthly, you should always be talking about maintenance and the long-term strategy. But for the purpose of training, I'm going to kind of summarize all of that into this short section because maintenance really is the most important aspect of care. Congratulations on reaching your goal weight.
Thank you. I feel really great.
And I just wanted to talk a little bit about how we're going to get you to stay there. First, you may remember on your recent body composition analysis, your basal metabolic rate was predicted to be 1,700 calories. But then we did the RMR machine, and we found that your actual metabolism was a little bit faster at 1,800 calories a day. So if we're giving you 1,600 calories a day, Monday through Friday, and then you're exercising for more than 3 hours a week, you would be banking 2,000 calories for the weekend, 1,000 from the 200 a day of calories, and another 1,000 from the exercise. So as far as food goes, you did the modified plan for a while. You were eating 550 calorie dinners. Now we're going to add another 1,050 calories for breakfast and lunch and snacks. That shouldn't be so difficult to do. And I'm going to really want to see you back in a month to see how you're doing. And I would also encourage you to use the appetite suppressants only on days that you feel you may need them. I know you've been doing well without them, but in a month's time, we'll see how you're doing with keeping the weight off. Some of the other aspects that are really important that I'm sure you would have realized by now is that your weight issue is a chronic disease. This is no different than hypertension or diabetes. And if I was treating your blood pressure and I got it under control with medication, I wouldn't say, oh, you're done, I never need to see you again. It would be, all right, you have to come back in 3 months, we'll see how the pressure is. Sometimes I'm going to do blood work as well. And it would be a long-term management plan. This is the exact same thing. You know, you've lost 50 pounds, but it's not going to be you're done. It's something that you always have to work at. And if we do it well, you'll probably be playing with the same 5 to 10 pounds every year. But at the same time, we'd be keeping off 40 pounds long term. And that's my expectation for every successful patient I have, is that perfection isn't an option when it comes to weight issues, but we just need to make sure that you remain accountable with us and you come in for periodic follow-ups. So some of the other tools that I feel we have available to help you with maintenance are the meal replacement products. I encourage you to use them at times, especially if you feel the weight is returning. Many successful patients have them every day for breakfast or lunch, especially during the week as part of their routine. But if you feel like you need to get yourself back on track, you're always free to come by and pick up the meal replacements. If you're still having a difficult time, we absolutely would want to see you sooner than your follow-up appointment in the future. The other option that a lot of people find helpful, especially when you're really busy working during the week, is possibly getting meal deliveries. We have doctor's orders meal delivery program where you could get dinners delivered every night, or you can get breakfast, lunch, and dinner delivered at 1,000 calories and at 1,500 calories. Some patients find this helpful. Some people do it just Monday through Friday. But it's a really useful tool to keep you on track and not have to worry about shopping and preparing food all the time. Another option is Capsiate. Capsiate is a hot pepper supplement that's only available through physicians in the United States. I actually have done a double-blinded placebo-controlled trial on Capsiate, and it was found to be more effective than a placebo pill. This was a 12-week trial, and at the 12-week mark, the Capsiate group lost an average of 19 pounds, whereas the placebo group lost an average of 11 pounds. So it seemed to be more effective, and the really neat thing is the patients who were on the Capsiate didn't really have any side effects to suggest that we would know it was any different than a placebo. The Ajinomoto Pharmaceuticals figured out how to remove the pungent side effects from the hot peppers so people don't get flushed and they don't feel racy. Whereas over-the-counter hot pepper pills usually have these side effects, so it's a terrific option. It is even safe to take with your high blood pressure. There's brochures available if you wanted to look over if it was right for you, but the other neat thing about the Capsiate is you could stay on it long term, and it may help to keep your metabolism a little bit faster, which will of course help you with maintenance. Some of the other additional option that I just wanted to make sure you're aware of is we do food sensitivity testing. Why it's sometimes important to know about food sensitivity is you may not realize it, but you might be eating foods on a day-to-day basis that your body's reacting to that are causing an inflammation, which in turn may be making you feel hungrier and of course could be slowing your metabolism. How food sensitivity testing works is we draw your blood and then we send it to the lab on ice, and we keep the cells alive, and then we take your white cells out of your blood and we introduce them to small amounts of food, and we see how reactive immunologically your white cells are to the different food choices, and then from there we compare that to normal, and we're able to see if there's foods that you're sensitive to. Now, the cool thing about food sensitivities is that these are not allergies. An allergy is something you usually have for life, and maybe you have trouble swallowing or breathing when you eat a food, or you get a rash. Why we wouldn't want you eating these foods on a day-to-day basis is it may make it harder for you to keep your fat percentage low or eat less. So if you did the ALCAT food sensitivity testing, we'd be able to give you a reference sheet that'll tell you foods that are good for your body and foods you should avoid. The interesting thing is this is temporary. Your immune system will reset itself every 6 to 12 months. So if a food is found to be not so good today, you avoid it for a while, it should be fine over time. But why I care most about it is by eating to what you're sensitive to, it may help you to obtain a lower fat percentage and not feel as hungry. And at the same time, it'll promote you reading labels and paying attention to what you're eating. So I think it's a really useful test, especially as you enter the maintenance phase of care, to think about having drawn. Any questions on all of that?
No, they sound like great options.
Okay, terrific. And so initially, I'm going to want to see you in a month. If you do well there, we'll bring it out to 2 months. If you continue to do well, we'll bring it out to 3 months. But in a perfect world, I really would always want to see you every 3 to 6 months, and of course sooner if you're having a setback and you're starting to gain back weight.
Dr. Kaplan, thank you so much for all your help. You've really been, a big inspiration to me, and I feel like I've gotten my life back and I'm on the right path. So thank you so much.
Oh, you're welcome, and I'll see you soon.